Partnered by Time's Influence.
Hello and welcome to the special show The Times of India presents Burning Issues, Managing Acidity Intelligently. You know, there are three things that usually trouble us: hurry, worry and curry. But we really don't give too much of thought towards acidity until we literally feel the burn inside us. Well, I'm joined by three eminent doctors today on my panel. Let me introduce them to you. First up, we have Dr. Hemant P. Thakkar. He's an internist, a physician and a cardiometabolic specialist. Welcome to the show, sir. I have with me Dr. Nandita Palchetkar. She's a gynecologist at Leedavati Hospital and she's also the president of FOXI. Welcome to the show, ma'am. And finally, we have Dr. N.H. Banka. He's a hepatogastroenterologist. Welcome to the show, Dr. Banka. Dr. Banka, first question straight up to you. Now, in a layman term, what is acidity? Why is it so important? And why should I not be ignoring it, which unfortunately we do very often?
You know, every human being has about 2.5 liters of acid normally secreted in 24 hours. Okay. If you take it out and put on the tile, it will erode the tile. Wow. Then how is the stomach protected against this? So, it's very important for us to know that though stomach secretes acid, it doesn't get really affected. But if this acid goes up into the esophagus, it can burn it.
Right.
If it goes unneutralized into the duodenum, it can burn it, producing ulcers. But the important thing is, if the stomach is inflamed due to some reason, then of course acid is injurious to the stomach.
And why are we hearing more and more conversations about acidity now? I mean, why are more and more incidents happening about this?
So, you know, there is a sudden deviation into the lifestyle pattern of the people, and the modern lifestyle has caused a lot of acid problems in the people. You know, they have burning in the stomach, they have pain, they have burping, they are vomiting, and you know, the lifestyle gets really disturbed by these. So, I think suddenly the limelight is now, what is acidity?
Right, okay, interesting. Dr. Thakkar, I'll come to you also on this. Your thoughts on this. Why is these lifestyle changes that are causing this?
Term acidity, which in erstwhile days used to be confined to gastroenterology, is now a loose term which is used to describe any disruption or a feeling of irritation, burning in the epigastric or stomach region, which emanates from so many causes. Gastric causes are the obvious ones, but stress, irregular eating habits, wrong foods, meeting timelines, digital lifestyle, all that is causing acidity. And acidity is a broad term to describe this dyspepsia, whether it is Dakar, whether it is burning, whether it is belching, whether it is not wanting to do anything as far as food related stuff is concerned.
As a gynecologist with dealing with ladies, with pregnant women, does that come up there now more and more?
Absolutely. I think acidity, as he says, you know, Hemant has said, it's become so common. In pregnancy especially, I think out of my 10 patients, 8 will have acidity.
Oh, wow.
And it's really crazy the way it is affecting. There are many reasons I feel that you see the acidity. First of all, you know, all these fad diets.
Yeah.
You know, they are causing a lot of changes in the food habits and all.
Really
and it's really bad. But in pregnancy, I tell them that please don't, you know, go into these diet habits. And pregnancy itself, the hormone of pregnancy, relaxes the muscles. So as they were talking, you know, that the muscle relaxes and the acid actually goes into the esophagus, and that can cause problems. Then in pregnancy, other problems also, like I'm an IVF specialist, so I use a lot of medications on my girls. You know, in the first 3 months, they're taking a lot of hormones, estrogen, progesterone, in high doses, and that really does also cause. So
this is very correct. The common feature where we see in medicine acidity, besides all this, is drug induced. whether you are keeping anti-diabetic medication, anti-hypertensive medication, anything drugs are going to cause. And
So I'll come back to you on that, but before that, Dr. Banka, with you being the gastroenterologist, how should we be treating this acidity? What are the correct steps that people should be taking, that our audience who are watching should be taking?
It's important for us to realize that, look, my stomach, if I am Marwadi, my stomach is used to Marwadi food. That's it, you can't deviate from that. Hemant's stomach is used to a Gujarati food. But suddenly these young guys, to look more fair, more energetic, they go on this. Almost 75% of the, the elite people come to us, they have this problem related to the lifestyle pattern and suddenly changing over to
So how do you guide them? How do you put them on the right path?
The best thing is to find out what has caused that, and then probably have a good interaction, counseling. And then of course we have very powerful drugs available now to suppress that. Gone are the days, I am the gastroenterologist of 70s where we did not have powerful drugs. We need to give milk, cold milk, then give antacids, Digin gel and ice creams, But that is all gone now.
Right.
People do take that now. Now we have the most powerful drug known as PPI, proton pump inhibitor.
Okay.
So we have a lot of things in the kitty now to treat these patients who have distressing symptoms, as Hemant mentioned, dyspepsia, ulcer pain, burning, burping. Yes.
So, Dr. Thakkar, I'll come to you. Could you briefly tell me what PPIs are? And coming back to your earlier point, which is when you have patients who are taking medicines for, cardiac issues, diabetes or any other issues, for pregnancy also, the IVF drugs that you were saying, how do you manage the correct balance between all these drugs?
See, first of all, the timing of these other drugs is important. Take it after meals, take it with some neutralization of food. But if you have a host of drugs which you must take and need to take, aspirin, certain blood thinners, all of which cause acidity, then you have to punctuate them with proton pump inhibitors.
Right.
In the olden days, they used to use ranitidine, which were H2 receptor blockers. But H2 receptor blockers, if you know modern maths, are only a subset of PPIs. So the basket of PPIs works already what the H2 receptors do. And proton pump inhibitors, they prevent the secretion and formation of acid, whilst the H2 receptors prevent the secretion secondary to a stimulation.
Okay.
So PPIs just close up and there is no secretion of acid, which brings me to the fact that you have to take it judiciously for a good period of time and under medical supervision. Anything which is potent can also be lethal. But if you use the potent drug, which I am saying you should, then you will get good results under medical supervision.
That's the important part, the medical supervision, the discipline, the continuity, not taken today, forgotten tomorrow.
If you look at the pregnant woman,
Yes.
what happens is, see, the first 3 months, I really don't like to give too much medication, because that's when the organs are being formed and the drugs tend to have an effect on the girl. So what we do is we do lifestyle modification, smoking and alcohol of course is a no-no, but small frequent meals, not to eat too spicy food. So all these things can change. And then the drugs that we have, if we are giving the drugs, then we definitely use antacids like proton pump inhibitors. And you have to be careful, though there is a recent study which actually says they're safe even in the first trimester. But as much as possible, I avoid them in the first trimester. And believe me, the acidity rises as the number of the months of pregnancy increase. This is because the uterus just grows and compresses on the stomach. So as the pregnancy progresses, they need more of these proton pump inhibitors, because it really is, very uncomfortable period. We want to keep her happy. This is a joyful time of her life. So I think it's the doctors or the obstetrician's duty to keep this woman absolutely healthy. And these are the places where we could use these drugs and, relieve them of their pain. Only one thing that I really would like to mention, later in pregnancy, you must be careful of this symptom, because sometimes it can be because of high blood pressure also. So we have to watch out for that also.
Well, on that note, it's time for a very short break. Don't go anywhere. We'll be right back. We're talking about managing acidity intelligently on burning issues. We'll be right back.
We are only the guide forces. So regular food, exercises, try and bust your stress as much as possible, and avoid black coffee, late nights, alcohol. will go a long way. Apart from just giving the medications, I think these factors are very, very important to control the acidity disorders. Yeah.
Welcome back to the Times of India, Burning Issues, Managing Acidity Intelligently. I'm joined by a panel of experts and we're in conversation to talk about the best way to manage acidity. Let's continue the conversation. Dr. Banka, so we've spoken about PPIs. We've seen that they're new, they're important, they're recommended. But the important part is it should be going to a correct doctor to get the correct dosage, to get the correct monitoring done. But I'll take a step back and I'll ask you, are PPIs safe and are all PPIs the same?
Today, in the educated families, these medications have become a dinner table tonic. So you have antacids, you have ranitidine, you have one of the PPIs. Truly speaking, we have almost 5 PPIs, starting from omeprazole and their molecules. If you look at the efficacy, they are all same. They are all same. Even today, like the omeprazole was the first one which, the early 90s came in. Then we have the pantoprazole, we have lansoprazole, we have esomeprazole, we have rabeprazole. So, as the time moved, the new molecules came in, we get more that, oh, this is going to be more efficacious and all. But all over the world, the kitty of omeprazole is almost to the tune of 40% all over the world. So, it's important for the patient to realize, and then when it comes to the doctor, we need to really explain him judiciously that, look, this can harm you in the long term. There are a lot of side effects of these drugs if you keep taking them for a long term.
Dr. Thakur, there was also some news about PPIs and some problems with kidneys. Is that something of concern?
See, it's a relative concept which has been misunderstood. Who takes PPIs? People who are stressed,
right?
People who have erratic eating habits, people who have comorbidities, hypertension, obesity, diabetes. Now, these 4 or 5 vices of life also cause kidney issues. A diabetic has kidney issues, a hypertensive has kidney issues, he has hyperacidity, so he takes PPIs, he's given PPIs, he doesn't follow the supervision, he feels that he should continue the PPIs along with his lifelong hypertensive medication. So, when his kidneys fold up, they say it's the PPIs. It's a question of subjective when it was started, how it was started, how it was continued.
Right.
Like any other drug, it has to be supervised. And as Dr. Banka correctly said, in India there is a fad that the latest is the best.
Yes.
We in the last 30-35 years of practice have seen that the first PPI which was introduced, omeprazole, still works very well and is still the best drug. In fact, I must point out that omeprazole is the only of its whole batch which has been put on the WHO model list of medications amongst the 5 PPIs.
Right.
So, it has stood the test of time. So, if you say that it causes kidney problems, it will also say it causes cancer, because 5 or 6 years later a person with comorbidities will cause cancer. So, it's a very relative concept.
Dr. Palshetkar, the other point I wanted to bring out is this lifestyle thing that all of you all have been talking about. This lifestyle changes, this rapid, and like what you were also earlier saying about those fad diets. How are you in your profession and in your experience dealing with this with the pregnant women or the women who want to become pregnant that come to you, even couples that come to you? How do you guide them?
I think, a lot of our patients are on these diets. Absolutely. So, we have to actually sit with them, counsel them, and some of them, because obesity has become a genuine problem today, it's an epidemic. So, a lot of them are trying to do these crash diets and lose weight, and in that bargain they are eating only, only fats or only proteins, or only, like, I don't think there's any carb diet yet. But yeah, all those, especially the keto diet right now, and I don't know, others, they cause a lot of acidity. And we are also giving them a lot of nutritional supplements, because our diet is very deficient. So, we are giving CoQ enzymes and other things, which are the essential amino acids, the minerals, the rare minerals. So, all this can cause acidity. So what we do is we try to give them something along with it. The PPI is the best one, and as Hemant has rightly said, we time it properly. You have to take it before meals, and then the medicine, the meals, and then the tablets. When there are lots of tablets, I think the PPIs work beautifully.
Dr. Banka, I want to talk to you. When you are recommending a therapy to a patient, how do you balance the cost versus efficacy?
Gone are the days of antacids. Gone. Gone are the days of ranitidine. Since we have better drugs available. But curiously, it's very important to know, even today, I think Hemant will endorse my views, that some of the orthopedic surgeons, some of the general surgeons, they still keep giving injections of ranitidine, and which we need to really get away with that. Why? Because there is an enzyme in the liver which metabolizes so many other drugs, and these enzymes get affected by ranitidine. In turn, the important drugs get poorly metabolized and they have toxic effects. So I think it's important that we should get away with ranitidine now. So omeprazole, now the first drug, remains the gold standard of therapy now, and that's the safest. But nevertheless, it's for me to decide how long the patient should continue. Before that, I need to decide that he needs further investigations, what we call as red flag signs. If the person losing weight, or he has black colored stools, or if he's vomiting blood, or is pain in the tummy, we need to rightly investigate him and then dissuade him from taking ranitidine just blindly or omeprazole blindly. So it's very important for us to really titrate this group of patients who needs this.
Your thoughts, Dr. Thakkar?
Yes, a lot of people still use ranitidine. The problem with ranitidine is it is not half as effective as omeprazole. Plus, over a period of time, ranitidine can cause a fast heart rate, quickening of the pulse, which can be bad for the patient, which can be circumvented if you have supervised omeprazole. And obviously, omeprazole, as he said, is the gold standard. And because omeprazole is the oldest, the price is the least. So my patients who are not finitely there for one system disorder like gynecology, who have diabetes, hypertension, obesity, kidney disease, are spending on the whole spectrum. So I would like to give them a drug which delivers the same efficacy at an economical cost, rather than flash the card of the latest drug and then he doesn't take something which he should be taking.
Dr. Banka, I'll take a few steps back. I'll come to the real start, where, for example, like me as a layman, I might have eaten junk food on a weekend, like we were saying, binging on the weekend. But if I've eaten junk food and I have a burn in my stomach, I might just go to the corner chemist, take some medicine, feel fine in 2 days. How am I supposed to decide that this is the time that I should be going to a doctor, or is it a one-off, then it should be okay, or if it's repetitive, how often is it happening? When, what are some of the symptoms that I should look at to be concerned and come to you?
We must find out what is the offending, the event which caused this. Just try and avoid that and give a little rest to the stomach. I think most of them will do well. I don't think it's a good idea that every patient coming with acidity or sudden developing problem needs a medication. Certainly no.
Right.
I would like to interrupt you here.
Right.
Heartburn can also masquerade a heart attack.
Yes,
Right.
exactly.
So do not take it lightly. What you said was what the common man does. I get up on a Monday morning, feel bad, go to the chemist and take medication. That's your mistake. Since when did chemists become doctors?
Exactly.
So you should not dig your grave there. Anything out of the ordinary which cannot be explained by your binge should be attended to.
Well, we're just about running out of time, but before I wind up, I'd like to start with you, Dr. Banka, and go down the line. Just your final message to our viewers, your thoughts on this important topic.
Unquestionably, the global phenomena of tackling the acid is the PPIs, proton pump inhibitors. Unquestionably, they are the leaders. And since Hemant mentioned, omeprazole is the drug which is cheaper, which is very effective, which is available across the world, all over. If you are traveling abroad, if you have another drug which is not available, why do you do that? But omeprazole is across the, I think this is very important message for all of us, that the cheaper drug, most efficacious, available across the globe, should be the drug of choice.
Thank you, Dr. Banka, for that. Dr. Palshetkar, your final word.
I think pregnancy is a beautiful time in a woman's life, and the first trimester of pregnancy especially, we should tell her to have, you know, small short meals and frequent meals, maybe every 2 hours, but little food. And also I personally feel that the drug that we use is a PPI, that is omeprazole, and it can be safely used in this girl so that she has a very beautiful journey ahead of her.
Thank you so much. Dr. Thakkar, final word from you.
If you are not having acidity, you are not an Indian in today's age, because with the humdrum and whiz of today's lifestyle, you're going to have heartburn, you're going to have acidity. Face it headlong, change your lifestyle, but hold the hand of medicine, good medicine, powerful, intelligent medicine that we have discussed, and you will win over your problem.
Thank you so much, Dr. Thakkar. Thank you, Dr. Palchetkar, and thank you, Dr. Banka, for being on this panel. Thank you so much for watching. You were watching The Times of India, Burning Issues, Managing Acidity Intelligently. As you've heard my panel of experts, this is something that is of concern, but we should be aware. We should go visit the doctor, take the right steps. Don't binge, manage your lifestyle. We just have one life. We should live it well, but always take care of ourselves. If you have any questions, definitely go out to your doctor, see the correct doctor, and get on the right medication or take the right steps that are required. Thank you so much for watching.
And in efficacy also, it was found that the PPIs were at least twice as effective as the H2 blockers. So there has been a gradual replacement in our armamentarium of H2 blockers. The PPIs have virtually taken over, and the PPIs, the first PPI was the omeprazole, and then since then there have been pantoprazole, lansoprazole, and I will not name all of them, but they are all a class of drugs that reduce acid secretion and are very useful in the management of peptic ulcer and acid peptic disease.
You know, acidity is because of a hormone called progesterone, which relaxes all the muscles of the body, and mainly it relaxes the muscle of the esophagus and the stomach. So then there's regurgitation of the acid into the esophagus. And also, as the pregnancy advances, second trimester, third trimester, it fills up the complete body. The abdomen is completely filled up, and this again presses upon the stomach, and there's regurgitation of acid into the esophagus, and this causes acidity.
Partnered by Times Influence.